Honorable members, let's pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and county assembly for the welfare of the society and the just government of the people, we beseech you to be all with your abundant favor as your servant, whom you've been pleased to call to the performance of the important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful manner as to promote your honor and glory and to advance the peace and prosperity and welfare of our county and those whose interests you've committed to our charge. Amen. Members, let's get seated. Clerk, next order.
Order number 1, administration of oath. Order number 2, communication from the chair.
Honorable members, I have 3 communications to make as enlisted here. Communication number 1, on planned training for House Business, Procedures and Rules Committee and the Speakers Panel. Honorable members, this is to notify you that a training session has been organized for members of the House Business, Procedures and Rules Committee and the members of the Speakers Panel, set to take place in Eldoret from 7th to 11th April 2026. The objective of the training is to enhance members' capacity in the discharge of their legislative and procedural mandates, particularly in the management of the House business, interpretation of standing orders, and effective presiding over assembly proceedings. All members of House Business, Procedures and House Committee and the members of the Speakers Panel are therefore requested to make the necessary arrangement to attend and actively participate in this important training. Further details regarding travel arrangements and the training program will be communicated in due course. I thank you, honorable members. Honorable members, communication number 2 on upcoming Legislative Summit 2026. Honorable members, I wish to bring to your attention the upcoming Legislative Summit scheduled to take place in Mombasa with proposed dates being 13th to 17th April 2026. Honorable members, the summit is a key annual forum and brings together members of county assemblies, speakers, clerks, and other stakeholders in the legislative sector to deliberate on matters of governance, legislative oversight, and representation. It provides a valuable platform for experience sharing, capacity building, and engagement on emerging legislative issues affecting county assembly across the country. Honorable members are encouraged to take note of the summit and prepare actively. Participate in sessions, discussions, and thematic engagement that will be undertaken. The insights gained from this forum are instrumental in strengthening our legislative mandate and enhancing service delivery to the people of Turkana. Further details regarding the actual dates, program, and logistical arrangement will be communicated in due course. We urge all honorable members to accord the summit the seriousness it deserved and to uphold the dignity and integrity of the County Assembly during the engagement. I thank you, honorable members. Honorable members, third communication. This is on planned County Assembly opening day when we resume from the recess. Honorable members, I wish to inform you that the County Assembly has planned to hold this inaugural open day on Tuesday, 21st April 2026, within the Assembly premises. The important initiative is part of the Assembly's ongoing commitment to promoting public participation, transparency, and accountability in legislative process. Honorable members, over the years, the Assembly has made deliberate efforts to engage the public through various platforms, including physical forums, social media, and radios, as well as by granting access to live proceedings of the County Assembly. Honorable members, the open day will provide a structured platform for citizens to interact directly with the Assembly and better understand its role, functions, and processes. Key activities will include guided tours of the Assembly facilities, interactive sessions on the role of the members of the County Assemblies, that is MCAs, civil education on public participation, and constitutional provision, particularly Article 118, among others. Honorable members, the objective of this program are, among others, to enhance civic awareness, strengthen public confidence in the Assembly, promote inclusive participation, especially among women, youth, persons living with disability, and elders, and equip citizens to engage meaningfully on key issues. Honorable members are therefore requested to make themselves available and actively participate in the important exercise, including engaging directly with members of public. Further details on the program and schedule of activities will be communicated in due course. I thank you, honorable members. Clerk, next order.
Order number 3, messages.
Honorable members, I have one message to communicate. On addendum to the message to the County Assembly on nomination of members to the Affordable Housing Committee. Good morning, honorable members. Further to the earlier message conveyed to this honorable house on 4th March 2026 regarding nomination to the Affordable Housing Committee, I wish to notify the House of a subsequent development. The Governor, on 24th March 2026, relayed a message to Office of the Clerk that Mr. Mahmoud Mohammed, ID number 2297-2014, who had initially been nominated to serve as a member of the Affordable Housing Committee, has formally declined the appointment. Consequently, and in accordance with the relevant provision of the law and standing orders, His Excellency the Governor has nominated Mr. James Karidhi of ID number 31-81-10-54 to replace the said nominee. Honorable members, pursuant to the established procedures of this assembly, the name of James Karidhi is hereby referred to the Secretarial Committee on Lands, Energy, Housing, and Urban Areas Management for vetting and approval hearing. The committee is expected to conduct the necessary approval process and table its report before this House within the prescribed timeline for consideration and decision. I thank you, honorable members. Next order.
Order number 4, petitions.
Next order.
Order number 5, papers, as listed in the appendix.
Leader of minority, proceed. Leader of majority, proceed.
Thank you, Honorable Speaker. I know you are used to the theatrics of the minority coalition, and I'm sorry, I am representing the leader of majority. Honorable Speaker, I hereby stand to lay the following papers on the table. 1, the report of the Auditor General on Turkana County Assembly members' car loan and mortgage. 2, the report of the Auditor General on Turkana County Water Services Fund for the year ended 30th June 2025. Thirdly, report of the Auditor General on Turkana County COVID-19 Emergency Response Fund for the year ended 30th June 2025. And lastly, report of the Auditor General on Turkana County Community Health Services Fund for the year ended 30th June 2025. I beg to lay.
Proceed. The majority whip. Thank you, Majority Whip. The above reports are committed to the Public Accounts and Investment Committee. Thank you. Next order. The Chairperson Education Committee to proceed and lay the paper.
Thank you, Honorable Speaker. Honorable Speaker, I rise to lay the report of the Committee on Education, Sports and Social Protection on matters relating to Turkana County Education Fund for financial year 2025-2026. Thank you.
Proceed, Chair. Next order.
Order number 6, notices of motion. Consideration of the report of the Committee on Education, Sports and Social Protection on matters relating to Turkana County Education Fund for FY 2025-2026.
The Chairperson, Education, Sports and Social Protection Committee to give the notices of motion.
Thank you, Honorable Speaker. I rise to give notice of motion that this County Assembly considers and adopts the recommendations contained in the report of the Committee on Education, Sports and Social Protection on matters relating to Turkana County Education Fund for financial year 2025-2026, laid before this House on Tuesday, 31st March 2026 at 9 a.m. Thank you, Mr. Speaker.
Thank you, Chair. Next order.
Order number 7, statements.
The majority will proceed.
Thank you, Honorable Speaker. I stand to present before this House the scheduled business for this day up to the 2nd of April. Honorable Speaker, this is the business that is meant to start from 26th up to 2nd April, but I'm starting from today's business. So in messages, we have appointment of the Turkana County Rural and Urban Affordable Housing Committee. And we have the following papers also: the report of the Auditor General on Turkana County Assembly Car Loan and Mortgage Scheme Fund for members for the year ending for financial years 2024 to 2025. Secondly, the report of the Auditor General on Turkana County Water Services Fund for the year 2024 to 2025. Third paper, the report of the Auditor General on Turkana County COVID-19 Emergency Response Fund for financial year 2024-2025. Fourth paper being the report of the Auditor General on Turkana County Health Services Fund for financial year 2024-2025. The last paper is the report on Committee on Education, Sports and Social Protection on matters relating to Turkana County Education Fund for the year, for financial year 2025-2026. That is, and then we have today also notice of motion, consideration of the report on committee, the report of the Committee on Education, Sports and Social Protection on matters relating to Turkana County Education Fund for financial year 2025 and 2026. And second motion for today is consideration of the report of the Committee on Health and Sanitation on share categorization of Lokitang Sub-County Hospital. Tomorrow, being Wednesday, the 1st of April 2026 at 9 a.m., we shall have the following papers laid here: the report of the Auditor General on Turkana County Health Services Fund for financial year 2024-2025, the report of the Auditor General on Turkana County Youth and Women Empowerment Fund for the financial year 2024-2025. That paper being the report of the Auditor General on Turkana County Emergency Fund for financial year 2024-2025. Fourthly, the report of the Auditor General on Turkana County Cooperative Enterprise Development Fund for financial year 2024-2025. Fifthly, the report of the Auditor General on Lodwar Municipality for financial year 2024-2025. Sixthly, the report of the Committee on Special Funds, accounts on the Turkana County Established Fund quarterly reports and financial statements for financial years 2023, 2024, and financial years 2024, 2025. We shall also have notice of motion on consideration of the report of the Committee on Special Funds Accounts on Turkana County Established Fund quarterly reports and financial statements for financial years 2023, 2024, and 2024-2025. Tomorrow, we'll also have a motion consideration on the report on Committee on Education, Sports, and Social Protection on matters relating to Turkana County Education Fund for financial years 2025-2026. Honorable Speaker, in the afternoon of Wednesday, 1st April 2026 at 2:30 p.m., we shall have the following papers. The report of the Auditor General on Turkana County Biashara Fund for financial year 2024-2025. Second paper being the report of the Auditor General on Turkana County Education Fund for financial years 2024-2025. Thirdly, the report of the Auditor General on Lodwar County Referral Hospital for financial years 2024-2025. Fourthly, the report of the Auditor General on Turkana County Executive State and Public Officers Car Loan and Mortgage Fund for financial years 2024-2025. And lastly, the report of the Auditor General on Lodwar Water and Sanitation Company Limited for financial years 2024-2025. A motion will also be there, a motion on consideration of the report of the Committee on Special Funds Accounts on Turkana County Established quarterly funds, quarterly reports, and financial statements for financial years 2023-2024 and 2024-2025. On Thursday, the 2nd April 2026 at 9 a.m., we shall have the following papers: the report of the Auditor General and on Lopiding Level 4 Hospital for financial year 2024-2025. The second paper will be the report of the Auditor General on Lokitang Sub-County Level 4 Hospital for financial year 2024-2025. The third paper will be the report of the Auditor General on Turkana County Urban Water and Sewerage Services Company Limited for financial years 2024-2025. Fourthly, the report of the Auditor General on Turkana County Rural Water Services Public Limited Company for financial years 2024-2025. And the last paper will be the report of the Auditor General on Turkana County Government Equalization Fund for financial years 2024-2025. And then there will be procedural motion on adjournment for short recess. Thank you, Honorable Speaker.
Thank you, Majority Whip. Clerk, next order.
Order number 8, question time.
Next order.
Order number 9, motion. Consideration of the report of the Committee on Health and Sanitation on SHA categorization of Lokitang Sub-County Hospital.
The motion mover, the chairperson, have.
Thank you, Mr. Speaker. Mr. Speaker, I rise to move a motion on report on the SHA categorization in Lokitang Sub-County Hospital. Mr. Speaker, I wish to move.
Go ahead.
Honorable Speaker, on behalf of the members of Committee on Health and Sanitation, and pursuant to provision of Article 185 of the Constitution of Kenya 2010, which gives the County Assembly powers to exercise its role on legislation, oversight, representation to the County Assembly's Standing Order number 30𝐓𝐇 A, B, and C. It is my pleasure and honor to present to this House the committee's report on SHA categorization in Loktang sub-county in Turkana County. Mr. Speaker, the County Assembly in a sitting held on Thursday, 10th December 2025 at 9 a.m. deliberate on a question raised by Honorable Michael Aoy, MCA Laproad, on the status of SHA categorization in Loktang Sub-County Hospital. The Speaker directed that the Committee on Health and Sanitation to take up the matter and invite the CCM Health Services and Sanitation to appear before it in order to shed light on gray areas raised by honorable members during the Committee on General Oversight on 26 February 2026. The committee met with CCM Health Services and Sanitation and prepared this report. Mr. Speaker, on behalf of the Sectoral Committee on Health and Sanitation, the pursuant to provision of County Assembly of Turkana Standing Order number 54/2, the committee is grateful to the Office of the Speaker and the Clerk for technical support accorded to it during this exercise. The committee further wishes to thank the County Department of Health Services and Sanitation for attending engagement sittings and providing the committee with the necessary support information to finish this exercise. I wish to express my appreciation to the honorable members of the committee and the Secretariat who made useful contribution towards the preparation and production of this report. Mr. Speaker, I wish to jump the preface.
Move on.
The committee mandate. Mr. Speaker, the Sectoral Committee on Health and Sanitation is constituted under Standing Order number 210, and the mandate is largely drawn from the second schedule, which states the function as follows. All matters relating to county health services, including in particular county public health facilities and pharmacies, and promotion of public hygiene, disease surveillance, campaigns, ambulance services, promotion of primary health care, licensing and control of undertaking the sale food to public, cemeteries, funerals, fallers, and crematorial and sanitation. Mr. Speaker, I wish to jump over the committee membership.
Proceed with the 2.0, that is matters that require further clarification, and then we move on.
Mr. Speaker, matters that required further clarification. Mr. Speaker, on 10th December 2025, the substantive speaker in his ruling directed that the question on SHA categorization of Loktang Sub-County Hospital be handled by the Committee on Health and Sanitation to scrutinize and verify written submission provided by CCM Health Services and Sanitation regarding a question that was raised by Honorable Michael Ewe MCA Lapurward on SHA categorization of Loktang Sub-County Hospital. Mr. Speaker, during the Committee of General Oversight, members raised issues that were not satisfactorily answered by CCM Health Services and Sanitation. At the end of the engagement, the presiding speaker highlighted a number of issues that required further clarification from the CCM as follows. 1, what is the current coverage of SHA categorization in Turkana County, and how does it compare with the national targets? 2, what specific measures has the County Department of Health taken to increase registration among remote pastoralists and vulnerable population? 3, how many public health facilities in Turkana County are fully accredited by SHA, and which level of care remain uncredited? 4, what changes are limiting facility accreditation, and what county intervention are in place to address them? 5, how are SHA funds managed, accounted for, and utilized at both facility and county level? 6, what has been the trend and reliability of SHA reimbursements, including any delays or claims rejections? 7, are health facilities adequately equipped with ICT infrastructure and trained personnel to submit SHA claims efficiently? 8, what categories as the county adopted the
Correction, what strategies? Reread it again.
What strategies has the county adopted to sensitize communities on SHA benefit and procedures? 9, what key system, connectivity, or capacity challenges affect timely claims proceedings, and how are they being addressed? 10, are there county-supported mechanisms to subsidize or support SHA contribution for the poorest household? Further, the speaker guided that the committee reports back to the House within 21 days. Immediately, the House resumes from long recess, and the committee's report will inform subsequent prosecution of the matter. Mr. Speaker, on Thursday, 26 February 2026, The engagement with the CCML Services and Sanitation, Chief Officer Preventive Health IG, Chief Officer Public Health, Deputy Director Medical Services and IG, Deputy Director Nursing Services was conducted at the Turkana County Assembly Chamber. Engagement with the CCML Services and Sanitation and the team. Mr. Speaker, the CCML Services and Sanitation made the following oral submissions before the committee. The total number of health facilities in the county is 194. Of these 37 facilities are not transacting and 107 have not renewed their licenses for 2026. The latter has been delayed by the lack of funds. He further updated the committee that Lactang Sub-County Hospital has been upgraded to level 4, and very soon the facility will be receiving funds from CHA to help in the maintenance of the facility. There is a budget allocated of 67 million for facility improvement fund once disbursed. It will be used to renew license for inactive facilities. This money is from the matching grant from Danidan Fund. Share registration and renewal of license is done for a facility where level on facility license are renewed by payment of 20,000 Kenya shillings. Most facilities left out of CHA registration are level 2 hospital, which are attributed to the distance to and from the facility. Lack of power among the other challenges, and these facilities are managed by the Nursing Directorate. Mr. Speaker, 270,000 people have so far registered for CHA, and we are currently at number 44 in the county from the previous number 47. The team promised that they will strive to do better by improving the number of people registered for CHA in the county. This will be done by employing other strategies like opening CHA registration exercise in all facilities, and by integrating CHA registration to food distribution exercise. At level 2 facilities, the nurses and area chiefs have been tasked to make sure children born in the village are issued with the birth certificates and are registered for CHA. Many people are not registered because they lack accreditation documents like identity cards and birth certificates, especially for refugees in Kakuma municipality. Heads of institutions have also been instructed to register people's students for SHA because some parents leave out their children when registering for SHA. Parents who don't have funds to register for SHA are encouraged to visit facilities where the nurse in charge will help them register using facility fund. Though it is the duty of SHA chief to register people for SHA, but have taken up this role for the interest of the Turkana populace. Hence, the reason why this exercise requires resources. Mr. Speaker, SHA is reliable now because the department has a live dashboard that is used to monitor all SHA activities in all facilities in the county, and all facilities are adequately equipped with the tablets to run SHA services through 30𝐓𝐇 of digital super highway.
Super highway.
Super highway.
Good.
The tablets are geofenced such that it only works when it proximal to the facility. The facility have made SHA claims where 137 claims have already been paid, and 64 million are still under review by SHA. Management of SHA fund is done for the 5th Act of 2023, passed by the Senate, and 5th Act of 2025 of the FIF Act of 2025 of the County Government of Turkana. Mr. Speaker, SHA funds have been used to improve facilities by paying staffs, buying medicines, and facilitating referral of patients by fueling vehicles. The primary health care services funds is also money from SHA claims benefit. The committee observation. Mr. Speaker, the committee observed the following: that the Department of Health Services and Sanitation has improved in SHA registration, where the county is number 44 in the country. This has been achieved because the department has employed more strategies and plans to increase SHA registration, such as registration of patients at the facility and during childbirth. 2, funds from SHA are adequately used to improve facilities and to provide other services such as buying of medicines, paying of staff, and fueling of ambulances vehicles. 3, all facilities have tablets that have been geofenced to make sure that it only works within the facility, and a live dashboard that has helped in monitoring patients visiting the facilities in real time. The department has proposed a budget to offer for uptake of the most vulnerable indigent, pastoralist, and marginalized population. Management and utilization of CHA funds is guided by the FIF Act 2023 of the Senate and Turkana County. FIF Act 2025. Collections of 10% of CHA claims were officially dropped by the CCM Health Services and Sanitation. It is no longer collected. Loktang Sub-County Hospital has been upgraded to level 4 hospital. All the necessary process of CHA registration were done, and it is now officially ready to receive funds from CHA. The county has 197 CHA active facilities. 107 facilities have not been licensed for 2026, and 37 facilities are not transacting by having not been licensed or entered an agreement with CHA. The committee recommendation. The committee recommends that the 107 facilities must renew their CHA license, and 37 not transacting or not signed agreement with CHA should be fast-tracked quickly to ensure smooth running of CHA services in these facilities. Medical superintendent in all sub-counties should be strengthened to register and collect more CHA money to manage and improve their facilities. Budget allocation to support CHA activities like sensitization and registration should be done by every ward. Awareness on CHA registration in the county should be done by CHPs, church elders, chiefs, school heads, political leaders in barazas. This will increase the number of registration. The Kimormor clinic outreaches should be used to reach out to all people through animal vaccination exercise. One Health approach should be funded so that when drugs are given to people and animals, people can be registered for CHA as well. Quarterly reports on CHA and updates should be shared with the Assembly. Committee resolution. Mr. Speaker, pursuant to Standing Order 198, this County Assembly considers and adopts the report of the Committee on Health and Sanitation on categorization of Loktang Sub-County Hospital. Adoption of the report. Mr. Speaker, the following members were present during adoption of the report: Patrick Napion, the chairperson, Linus Echeme, the vice chair, the Bedwell Kobongin, member, Honorable Michael Ewoy, member. Honorable Lynette Abok, member. Honorable Julius Apron, member. Honorable Ellen Kaile, member. Honorable Omodo, member. Honorable Sarah Abdi, member. Mr. Speaker, the committee anonymously adopted the contents of the report, and I append by signature on behalf of the committee, and I beg the House to consider and approve it. Thank you, Mr. Speaker. Mr. Speaker, I hope this report is clear, and I persuade my colleagues to give their contributions of this report of SHA on Laktang Sub-County Hospital. Mr. Speaker, in this report is talking about the challenges that we are facing in all health centers of SHA. You see, our government brought SHA to the country so that everybody can access health facility where he is or he is. So, Mr. Speaker, I would like my honorable members to deliberate over this report. Thank you, Mr. Speaker, and I wish Honorable Lynette Abok to second.
Thank you, the Vice Chair, for the Committee on Health and Sanitation. Honorable Lynette Abok, proceed seconding the motion.
Thank you, Mr. Speaker. Mr. Speaker, I rise to second the motion. Consideration of the report of the Committee on Health and Sanitation on SHA categorization of Laktang Sub-County. Mr. Speaker, if you see this report, Mr. Speaker, basically the SHA system in the county is underperforming because of many issues that we have raised here as the committee.